I'm Lauren Todorovich from Hello Care, and we are at the Be the Change 2017 Dementia Australia event today. And I'm joined by Dr Tiffany Jessop. Thank you for joining us.
Thank you for having me.
So, you've just presented on antipsychotics and some of the really important research and body of work that you've been doing. Would you mind just sharing a little bit about that for us?
Sure. Yeah, the project that I worked on with the Dementia Centre for Research Collaboration at UNSW was called Halting Antipsychotic Use in Long-Term Care, or the HALT study. And this was aiming to reduce the inappropriate use of antipsychotics for residents living in long-term care facilities without sort of a re-emergence of their behavioural and psychological symptoms that they were originally prescribed these medicines for, and also without substituting antipsychotics for other potentially harmful medications such as benzodiazepines. So we had 23 aged care facilities involved in the project and about 140 residents who were taken off their antipsychotic medication. 126 of these residents that we originally recruited were successfully deprescribed or had their antipsychotic medications withdrawn. And there was about a quarter of those who did go back on their medications for a variety of reasons, mainly after incidences of aggression or agitation. They were the main two reasons why people were put back on their medications. But overall, the trial was extremely successful and demonstrates that we can and prescribers should be trying to withdraw these medications as soon as they can.
I guess for families, to sort of understand their rights a little bit too, because it's often a first time experience if someone has been prescribed antipsychotic. What's the sort of process and what should families be aware of if they've got a loved one that has been prescribed these?
The first thing to note is that if someone you love or you are experiencing behavioural and psychological symptoms of dementia, and when I say that, that includes things like agitation and aggression, anxiety, irritability, wandering, things like that. These antipsychotic medications only have a limited benefit, and that benefit is confined to just the symptoms of agitation and aggression and psychotic symptoms like hallucinations and delusions. So if your GP is prescribing these medications, you should really talk through the risks and potential benefits of using these medicines, and know that just like any medication or any treatment, you have a right to question whether these medications are necessary and look at alternatives.
Yeah, that's really important, I think. And I guess the other side too is for aged care workers. You mentioned in your research that they played a big part in the, prescribing or providing information to the doctors around prescribing. What sort of recommendations would you have, from your findings for aged care workers?
This is a tricky question because, historically there is a culture of prescribing for behavioural and psychological symptoms of dementia. And in the residential care facility, it's very easy for us to say that, for the majority of residents, these medications shouldn't be used. But it's also about looking at the resources and the staffing and education available to aged care facilities to support the reduction of these medicines. So in our project, we supported the deprescribing with education provided to aged care staff and champions within each of the facilities involved, and also GP education and information provided to pharmacists. So I think one of the key messages from our project is that everyone involved in the care of residents needs to be on board and involved, and there does need to be education and support provided to aged care facilities to facilitate the reduction of these medicines.
Look, this is really great work and all very important. And I know that you had mentioned that there was some more projects that you're working on. So you can just tell us where to next.
So the HALT project and a lot of other projects have targeted aged care facility staff and, to a lesser extent, GPs to provide education about antipsychotic use for behavioural symptoms. But we feel like the next and really important step, the essential step, is to engage consumers in this conversation And so myself and my colleagues, Professor Carmel Pisa and Professor Henry Bradati, have received funding for the Empowered Project. And this project is all about getting people with dementia and their families and carers involved in understanding and raising awareness about the use of antipsychotics for behavioural symptoms, what their rights, their ethical rights and their legal rights are around the prescribing of these medicines, and empower them to be informed and supported decision makers in the care that they receive.
That's really great. Thank you so much for your time today.